following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm Shay Paul, and I am being joined by Dr. Jared Chapman and his guest, Heather Ellis. Thank you both for being with us.
Thank you for having us.
So this is part 3 of Heather's journey in her day with Dr. Chapman, and it started a couple of weeks ago with her initial consultation. Last week, we got the treat of seeing you actually inject Heather with Voluma, which just gave her such a refreshed, glowing appearance. As we were talking about before, she was already gorgeous, but what you did was you enhanced her good features. So today we're going to continue this journey with Botox, correct? Okay.
So the main thing about Botox is prevention. We want to try to prevent the line before it forms. But we also can do some neat things with Botox because we're dealing with muscles and how they contract. So we can actually, when we're treating Heather, give her a slight lift to her brow, which will open up the eye and make the eye look even brighter. As the audience can see from last week, even the treatment we did, there's a definite change under her eye where the volume loss had occurred. Not a drastic change, not something that makes her look artificial, but just restoring a little bit of volume that time takes from us. And then, you have this rested look.
And I just mentioned real quickly that if our viewers will reflect back to last week's episode, or if you get a chance, watch it online or go, to your website and see it there, because we showed her after you had only performed it on one side.
Correct.
And you really notice the difference when it's side by side. Now, of course, you've done the other side, and she looks great, but I'd really like our viewers to see the difference.
Absolutely.
That it made.
We're going to begin with the Botox, and the most common area that patients come in and ask about is the 11s between their eyes. Heather has done an excellent job of keeping her Botox up over the last few years, which has allowed her to almost eliminate any line in this area.
The 11s.
Skin nice and fresh and looks very natural. I always like to leave the patient with a little tiny bit of movement. Sometimes patients don't like that, but a little bit of movement allows you to look natural. I don't want you to be able to completely crease the skin, but I do like to see a little bit of movement that occurs naturally. I think Heather can vouch for me that happens with her treatment. So I'll let her lay her head back. The audience can see just a simple few injections in this area. We actually put about 5 small injections. Squeeze your eyes together for me. I usually have the patient animate while I'm doing this procedure so I can see exactly where the muscle boundaries are. As you can see, I'm using, if you can't see, I'm using an insulin syringe. So it's a very small syringe. I've completed the injections in the 11. So if someone was just coming in for that area alone, that's how quick, that's how simple.
I was going to say that was so quick. Heather, what was the pain level on 1 to 10 scale?
It's a 1. I can't complain. It's
right. Okay.
So to treat the upper lines of the forehead, we come in, and these are, again, not seen on Heather because she does a good job at keeping this at bay. I have her raise her brows for me, and then I go in and I inject what's called the frontalis. The frontalis is the fanning muscle that occurs on the forehead, and it works to lift the brows. So I don't want to take the lower portion of this muscle out because I want her brows to stay nice and lifted. But I do want to take out the upper portion of it so that her upper forehead will stay smooth. So my trick that most people don't do is this little trick here. And what I'm doing is hitting the lateral fibers of the orbicularis oculi. It's a circular muscle that goes around the eye. When I take out these lateral fibers here, what happens is that muscle is like a sphincter. It's going to squeeze down when it contracts. By taking these lateral fibers out, it will still work in here and in here, but it will leave it relaxed here. And what that does is allow the eye to lift up.
Lift, I see. Okay.
So when you're treating with Botox, it's all about knowing what the muscle does
Right.
and what you want to get the muscle to do for you, whether it's relax or contract, to get the lift that you want. Raise your brows one more time.
And I just wanted to point out one thing that you've mentioned several times during this journey, and that is that Heather has always been good about staying constant or consistent, I should say, with her Botox injections, because that is a treatment that really an ounce of prevention is worth a pound of cure. You have to be proactive with it.
And she does good skincare too, and that's why she has this nice glowing skin.
Okay.
And during the lateral aspects, we're hitting around the lateral fibers of the orbicularis oculi. So we just put a few simple injections in here, and this is the most sought after treatment area in males. Males will come in complaining of what we call the crow's feet, or the lateral canthal lines is the scientific name for them. And just a few simple injections into this area will calm these lines down and allow the male face to look more refreshed and rested. So.
And then in 2 weeks, we're going to see the final and complete results of these procedures, correct?
That's correct.
Yay. So we're going to get to see Heather. You look gorgeous, as always, and nice and refreshed.